Massage therapy test questions and answers with explanations. 25 essential questions. Question 1. Which massage stroke is characterized by long, gliding movements toward the heart? Petrie's sage, effleurage, tapotement, friction. Effleurage is the classic gliding stroke used to warm tissues. Question 2. Which muscle is known as the boxer's muscle? Biceps brachii, serratus anterior, pectoralis major, triceps brachii. Serratus anterior is used in the punching motion. Question 3. What is a local contraindication for massage? Fever, varicose veins, nausea, high blood pressure. Avoid the specific area of varicose veins, but the rest of the body can be massaged. Question 4. Which of the following is a symptom of inflammation? Pallor, coolness, swelling, edema, numbness. The 4 cardinal signs are redness, heat, swelling, and pain. Question 5. The origin of a muscle is generally located at the most mobile attachment, at the most stable attachment, in the middle of the muscle belly, inside the joint capsule. The origin is the fixed attachment, while the insertion moves. Question 6. Which muscle group is responsible for knee extension? Hamstrings, quadriceps, adductors, gastrocnemius. The quads, rectus femoris, vastus lateralis/medialis/intermedius, extend the knee. Question 7. What is the appropriate action if a client has a fever? Massage vigorously to sweat it out. Perform only light effleurage. Reschedule the appointment. Systemic contraindication. Use ice packs during massage. Fever indicates the body is fighting an infection and massage is systemically contraindicated. Question 8. The term supine means the client is lying on their stomach, on their side, on their back, with their head down. Supine is face up, prone is face down. Question 9. Which stroke involves rhythmic tapping or striking? Vibration, friction, tapotement, effleurage. Tapotement includes cupping, hacking, and tapping. Question 10. What is the primary purpose of cross-fiber friction? To increase relaxation, to break up adhesions and scar tissue, to warm the skin, to move lymph. Cross-fiber, James Cyriax, friction helps realign collagen fibers. Question 11. Which muscle is the prime mover for elbow flexion? Triceps brachii, brachialis, deltoid, trapezius. While the biceps help, the brachialis is often considered the strongest elbow flexor. Question 12. What is proprioception? The sense of smell, the awareness of body position in space, the ability to feel pain, the regulation of blood pressure. Proprioceptors in muscles and joints provide positional feedback. Question 13. Deep vein thrombosis, DVT, is most commonly found in the neck, arm, lower leg, abdomen. DVTs usually occur in the deep veins of the calf or thigh. Question 14. Which organization administers the MBLX exam? NCBTMB, FSMTB, AMTA, ABMP. The Federation of State Massage Therapy Boards, FSMTB, administers the MBLX. Question 15. A client with osteoporosis should avoid which type of massage? Light effleurage, deep tissue/heavy pressure, energy work, facial massage. Deep pressure can cause fractures in weakened bones. Question 16. Which joint is a ball and socket joint? Elbow, knee, shoulder, wrist. The glenohumeral, shoulder, and hip joints are ball and socket. Question 17. What does the pincer grasp in Petrie's sage involve? Using the whole palm. Using the thumb and fingers to lift tissue. Using the knuckles. Using the elbows. Petrie's sage involves kneading and lifting the tissue. Question 18. Which of the following is a bony landmark of the scapula? Acromion process, greater tubercle, olecranon, styloid process. The acromion is the high point of the shoulder on the scapula. Question 19. Massage helps reduce stress by lowering levels of which hormone? Serotonin, oxytocin, cortisol, dopamine. Cortisol is the stress hormone reduced by relaxation. Question 20. The S in the SOAP note stands for summary, subjective, schedule, specialist. Subjective info is what the client tells you, example, my neck hurts.